If you look at the milestones that a baby should be achieving by the time they're 3 months old, they should be able to bring their hands together to play, they should be able to bring their hands to mouth to self-soothe, should be starting to try to roll a little bit to the sides as well, and they should be able to try to kick off the surface most of the time when they're resting on their backs. So when you think about those milestones, you try to stimulate those milestones. You can play lots of cycling activities with them just to get them to engage their tummy muscles. And whenever you change their diapers, you can try to roll them a little bit to the sides. So this helps them to engage their tummy muscles. And not to forget tummy time. So you've got to give them tummy time every day so that they develop their head and neck muscles as well. The baby's going to actually develop lots of new milestones from between 4 to 6 months of age. So when they're actually lying on their back, the baby's going to try to reach out for toys. They're going to start to reach out for their legs as well. This is telling us their tummy muscles are getting stronger. So offering them objects as well overhead to encourage them to reach, as well as, helping them to bring their feet to their hands, to encourage them to hold on. This is going to make their tummy muscles stronger. So now from 3 months to 6 months, they should be able to flip all the way to the tummy. And you can also do lots of side lying play, because when you're in side lying, you're already halfway there, and then you just need to do that little bit of extra movement. Also, when you're lying on their tummy, they should be able to push up all the way, and they should be actually starting to reach out for objects. They should also be starting to move in circles as well. Also, when you place them in sitting, they might try to use their hands to push themselves up for a couple of seconds, just a very short period of time. But if you find that your baby is not doing that well and slouching too much, they may not be ready for this sitting activity just as yet. So again, tummy time at this age, very, very crucial for them to develop all their milestones that they have to achieve. All of these exercises help the baby to develop the physical as well as their sensory systems in order for them to achieve their age-appropriate milestones. So you want to try to incorporate all of these exercises into their daily routine rather than make it an extra task that you need to complete, because that's going to add stress to you as well as the baby. So you also want to give baby lots of cuddles and baby body massages just to make them aware of their sensory systems. You want to encourage baby's responses by presenting objects with high contrast. So initially you start off with black and white contrast, and then you can move on to bright colored objects, and just talking and singing to baby to encourage them to actually respond back to you. Babies should actually start exercising right from the start when they actually come home, and these exercises can be fun, and it's a great bonding experience between you and your baby. The first thing is, when they're lying on their backs, try to get them to bring their hands to the middle, to play with their hands to the middle. This is going to give them midline orientation, and then after that you're going to want to actually attract their attention with contrast cards or just with faces. Make sure that when you're using contrast cards, these cards are at least 8 to 10 inches away from the face. Get them to look at the card and then turn to the side slowly. As baby actually gets stronger, you're going to notice that baby is actually able to turn further to the sides. So offer them objects overhead. This is going to encourage them to use their shoulder muscles, and then after that slowly encourage them to reach for their feet as well. This is going to engage their core muscles and prepare them for the next stage of rolling to the sides. Whenever you change their diaper as well, you could bend the hip and the knee and then roll them slightly to the side. And as they get older, so after 3 months of age, you could flip them completely over onto their tummy. So when baby is lying on their back, you could also do lots of cycling. So babies kick, but you've got to actually notice how the baby actually kicks. Is it just on the surface or is it off the surface? As baby gets older and stronger, you want them to be actually able to kick with their legs off the surface most of the time. So when baby is lying on their back, you could place a small towel roll just under the hip, so when their legs are a little bit lifted off the surface, and when they kick, they're going to engage those deep tummy muscles, those core muscles better, and that's going to give them enough strength to be able to roll all the way to the tummy later on. You can also carry your child facing outwards, and this is going to encourage them to turn and look around and develop their head and neck muscle control while being well supported by you at the same time. You could also practice them getting to hold their head and neck up on their own by placing them off your chest slightly, just in little bouts of 10 to 20 seconds, just to allow them to practice independent head control. Usually you can start this activity at about 2 months of age. So don't forget your daily tummy time, and from the moment you actually bring baby back home, make sure that you're not always placing them on their mittens, because that's going to actually hinder their grasp development. What we actually see is that babies that are placed in the mitten all the time develop something called a thumb in palm. So you want them to actually be able to open up their fingers. So this encourages grasping and lots of sensory development as well. Also ensure that you change positions for baby very frequently. So if you're putting them in a cot, try to face them the right side in the morning and then change them to the left side in the evening. Also approach baby equally from both sides so that they don't actually develop a head turn preference to any one side. Tummy time is a very important activity for infants' core, motor as well as sensory development, and it helps them to achieve their milestones. It also helps baby to develop their head and neck muscle control, strengthens their back muscles, shoulder and core muscles, and it helps baby to prevent any kind of flat spots on their head, also known as plagiocephaly, or any tight neck muscles, also known as torticollis. Tummy time should begin as soon as you bring baby home from the hospital, and you should aim for about 30 minutes of tummy time every day, but don't feel pressured to do it all at one go, and baby might not tolerate that as well. So start off with bouts of 2 to 3 minutes of tummy time each session and do it a couple of times a day. So as baby gets stronger and more used to the positions, they will be able to tolerate longer periods. So don't be discouraged if baby fusses, that's alright. So little gains. So as long as you're doing a little bit every day, consistency is very important. So you might want to try different positions that baby tolerates. Tummy time need not only be done in one position. So the first one is something that most of us are already familiar with, something similar to kangaroo care. So maybe when you're sitting reclined on the sofa or a chair, you can place baby on your chest and then you can hold them down firmly just for safety reasons. Talk to them lots in this position. This will encourage them to use their head and neck muscles and try to lift their head up to look at you. The next position is when you're sitting on a chair, you can place baby on your lap, hold their bottom down, tuck their hands under their chest, and then talk to them again. So this auditory stimulation is going to actually encourage them to turn towards you and build on their head and neck muscle control. The third position is called the aeroplane carry position. So when you're in a standing position, you can actually place baby's tummy right down here, and then you can do like an airplane swing position. So some babies tolerate this better rather than being placed completely down. It also actually helps some gassy babies. So if your baby is a bit bloated or colicky, this could actually be a great activity for the baby. So the last position that we're going to talk about is actually the hardest one for the baby. So when you're actually placing baby on the ground, you're going to put a rolled towel under their chest, tuck their forearms onto the rolled towel, and then hold their bottom down. So this will allow baby to focus on just their head and neck and lift their head and neck up and strengthen all those muscles. Make sure that you're only doing tummy time at least 1 hour after their milk so that we don't cause them to regurgitate and throw up anything. And always make sure that baby is supervised during tummy time activities. Kicking actually helps baby to strengthen their tummy as well as leg muscles and helps them to reach their milestones, but it does not actually make them taller. Overall, make sure you're doing tummy time every day with the baby. Doesn't matter how long you're doing it for, consistency is very important. Just make sure you're trying your best, little bits every day, and celebrate the small gains. Just make sure you're connecting and engaging with your baby on a daily basis.